Hi, my name is Reagan Breaker, and this is for the final in IPE 575. First off, I would like to say thank you so much for your time in this interview. I've worked in healthcare for the last several years, starting as a unit assistant, worked my way up as a CNA, and then eventually as a nurse. And I'm excited for the opportunity to interview for this next step in a leadership position. I do believe that my roles already in the healthcare working kind of from the bottom up have given me a lot of different views and some different perspectives that I can bring to the leadership table. I see one of your questions was my thoughts on diversity in leadership. Different leaders I have talked to have had some different answers from their experience, just as I have tried to gain an understanding of different medical leaders and their different perspectives. My personal opinion on diversity in leadership is that it is very important, not only for the leaders to be diverse, but to understand the diversity in the employees that they are leading. I believe it is important to understand diversity in gender, experience, ethnicity. Everyone has a different experience, and I believe it's important to show employees that they are important and their experience has mattered and that I value their experience already and their thoughts and opinions. So, my belief on diversity in leadership is to appreciate and show appreciation to each one and their perspectives. I believe, especially in staff meetings, giving people with their concerns, differing opinions, the chance to speak up and show that they are heard and not just brushed off in the meetings, that they are heard and that I'm actually taking into account their opinions and thoughts. Another question I saw on here was conflict management in the workplace. This one I think can be kind of kind of tricky, especially I've know some leaders have been friends with other employees in the past and that has raised issues. I believe in being firm, fair, and equal, being consistent in how I handle things. So I believe that I would like to give my employees the autonomy to try to problem solve themselves first. I would like to build that trust with employees that I trust them and to work it out themselves. But then at the same time, when they're not able to work it out, they trust me with their issue to come to me together. I would like to talk to employees separately and together to get an understanding of what happened. And then, unfortunately, I understand written verbal warnings are a part of this role and determining who gets what, but always handling situations in the same way and being consistent, showing that I want to be approachable. Unfortunately, I can't necessarily be their friend, but I can be an ally for them. And so I would like employees to trust me, to come to me with their issues, hopefully to work through it before it becomes too big of a problem. Always ensuring patient safety, number one priority. That is a non negotiable for me. So I would like to meet with employees separately and together to get an understanding of the situation. Always understanding, I believe there are three sides to every story: his, hers, and what really happened. So understanding that it could have differing accounts, potentially talking to eyewitnesses and whatever the situation might be. But also, I would like to hope I would have a mentor to go to too on how they've handled it in the past. Um, have other people in the leadership position that I can go to for advice as well when I'm not sure how exactly to handle it. Uh, I hope that answered your question. And then I see one question about the Great Resignation and how to retain current employees and attract new employees. This is such a great question, especially because I worked through healthcare during the Great Resignation. Um, it was a very interesting time for everybody, trying to retain employees, having different employees come in from travel agencies. I personally was seeing inequalities in how current employees who had been loyal to the company I work for a very long time, and now they were making exponentially less than these travel agencies. Don't get me wrong, I completely understand the need for travel nurses to different areas with a higher patient load than we might have had in Springfield, Missouri. I saw many nurses being sent home because of elective procedures being pushed off, or people being encouraged to stay home, therefore, fewer people on normal medical surgical hospital floors. Understanding there was not as big of a need for med surg nurses as potentially ICU nurses, and so on. So I think that caused a great rift in cohesiveness and teamwork. I have a lot of friends who are travel nurses now, and I see them taking to Facebook and social media platforms complaining that they're getting heavier workloads than maybe the other nurses who have worked for that specific healthcare entity already. And so just a lot of different division, because then I hear staff nurses with my healthcare system I work for now saying they should make they're making more, they should get a heavier load. And I see both sides of that. I see it's a big, again, into the conflict management with, I'm sure, many nurses seeing things differently on the same floor, trying to work together to save lives. So I believe treating the employees that we have now with the same respect, that is my biggest thing. I want every employee to feel the same appreciation and value. I want to hear their concerns that, they're making less than travel nurses are. And I know that is also kind of subsiding now with COVID, knock on wood, dying down right now. But hearing that, and I want, again, going back into being approachable as a manager, I want to be able to address the concerns. I want every team member I have to feel valued and like their opinion is heard, and I care about them individually, and I care about the floor cohesively. I do believe, um, yeah, we all have different experiences, and I want to be able to hear their concerns from previous leadership potentially that they've seen. Um, I do believe in the transformational leadership style of being relational and caring about the person and growing their skills. As for growing the company and bringing different nurses to our specific floor, I my mom has a background in HR, so I grew up hearing about employee retention and having to let people go, but what are you doing to retain your employees? How can you outreach to get people interested in your floors? So I believe that job fairs are a great way to make your floor sound fun and interesting. I believe that bringing different employees with me, so it's not just, the business suits showing up, you also have the people who are in there with the patients who can answer more of the day-to-day questions of how the team works together, how CNAs and nurses and doctors on the floor, how they all fit together to work in the piece of the puzzle. So I think bringing, yes, the colorful boards about our floors, the candy bowls, the games, the prizes to draw in attention, but I think having employees who work in the day-to-day patient care come to job fairs with me, community outreaches, educational programs for the community to show and educate the community on what our specific floor is for, whether it's the cardiac or the pulmonary floor, educating on specific disease prevention. And I think that could bring in showing the community outreach. Nurses go into the field to make a difference. So I think showing the community that our floor cares about making the difference, and the employees with me, standing up beside me as their leader, showing the teamwork we have as a unit, could make us even seem more appealing to other nurses coming to interview for the positions. I hope I have answered your questions, and I thoroughly look forward to hearing back from you. Thank you so much for the opportunity to meet with you today.